thank you for being here today. We're excited and so pleased that Dr. Price is here. And I get to the honor of running through the very extensive bio, and she's quite accomplished. So Dr. Acosta Price is the director of the Center for Health and Healthcare in Schools at the George Washington University Milken Institute School of Public Health, and an associate professor in the Department of Prevention and Community Health at the university. She received her undergraduate degree in psychology from Vassar, and her master's and PhD in clinical psychology from the State University of New York at Buffalo. She began her professional career as associate director of the Center for School Mental Health Assistance, a national technical assistance center, and assistant professor at the University of Maryland School of Medicine. And upon her departure from Baltimore, she accepted a position as a director of the school mental health program at the Department of Mental Health here in DC, now currently Department of Behavioral Health. And as a founding director, Dr. Acosta Price launched comprehensive school-based mental health programs in more than 30 public charter and DC public schools over 6 years. She managed all aspects of program development, implementation, evaluation, quality improvement, and staff training and supervision on this model of service delivery, while overseeing an annual budget of over $4 million. Quite an accomplishment. She is currently the chair of board of directors for the Coalition of Schools Educating Boys of Color, a steering committee member of the National Suicide Prevention Resource Center, and a co-chair of the DC Task Force on School Mental Health, among other advisory roles. She's written numerous articles and book chapters on children's mental health and school-based services, and has presented at national conferences, meetings on children's health, and won many awards and recognitions, including the 2018 Martin Aschow Community Service Award from the American Academy of Pediatrics Council on School Health, and the 2019 DC Champion Award for the School Social Work Association of DC. So we are so thrilled that Dr. Acosta Price is here today to give her presentation. Thank you.
Thank you so much. Well, I do feel like I'm among friends, and thank you. This is actually a fantastic turnout. I thought when they told me I was competing with coronavirus, it was like, well, all right. So thank you for being here. I'm going to jump right in because I have a lot I want to share with you, but more importantly, I do want to hear from you. I'd love to kind of have a little bit of dialogue, and more than happy, certainly, to also talk offline with you. I want to tell you a little bit about my center, because my title said I'm really interested in ways to continue to support the translation of science and research and evidence, and what role an applied research center has in such an endeavor. The center has been in existence in some shape or form for about 30 years. Our founding director is Julie Graham-Lear, and if you don't know her, she's a pioneer in school-based health centers, and really from the 80s had been writing and helping to manage with one of the first big awards from Robert Wood Johnson Foundation, some of that work in spreading that model nationally. So I'm very honored to have mentored under her. And our center, which we really consider to be at this intersection between health, healthcare, and education, is one where the vision that we aspire to is a society where school and community environments foster health and opportunities for all students. The key word for us, or phrase, although it's the driving statement for us, is school and community environments. Okay, and I'll dive into that a little bit more. And that our mission really is about these school-connected approaches to allow us to advance what we know to be effective school health programs, policies, and practices. Now, our center focuses on school health broadly, so we really think about health in its broadest sense: physical health, mental health, oral health, and the integration in schools. I'll be talking more about behavioral health, mental health, because that's my area of interest and expertise, but just so that you know, and I hope that you will check out the center, healthinschools.org, when you have a moment. One of the things that I love to share and feel proud of is that our center is a national school health center that is the only one that is housed in the School of Public Health. And to me, part of why that's important, although I am not traditionally trained in public health, I am like a stepchild of public health. I've joined it, I feel at home, I love it, but I was trained traditionally in clinical psychology. But certainly, I trained under Murray Levine, who's a very big clinical community psychologist, so I knew about Bronson Brenner's model before I realized really how influential it is, and the importance of this person-environment interplay that is sort of constantly impacting health and health outcomes, as well as educational outcomes. So public health and our emphasis on the environmental social factors, essentially the social determinants of health and education, is a lot of what we continue to think about and the various levels of the social ecology, which I'm going to run through quickly. And that we recognize that our work, as well as sort of both how we do it and how we research it, is about collaboration. So much of what we want to understand is what does effective collaboration look like, and how do we facilitate it, and because our premise and part of our argument is that this work is so complex, and the drivers of health and education are so complex that no one sector, organization, entity can actually impact it alone, especially if what we're talking about are dismantling some of those drivers that impact a lot of our health conditions. So as I said, the socio-ecological framework really is a lot of what guides our work, not just our research, but a lot of our other work, which I'll run through quickly. Again, in school health, traditionally, and some of you, I think, identify as school health researchers, practitioners, advocates, the focus on the individual child makes sense. And what we want to see are sort of thriving children, able to sort of access their education and do great things. But our focus really is both on kind of children's immediate environmental context and the characteristics of those environments. And as you can see, that system that really influences so much child outcomes. And our particular interest in schools and understanding the characteristics of schools, what drives effective school practices, which again I'll go into in a little bit. And then certainly that those systems closest to the child and family also exist within a broader social and structural system that impacts child development. And so we always try to think in those terms, even if our specific research that isn't able to really uncover some of the pathways along all of those lines. I wanted to share this with you because Leandra was telling me about the SIG, yeah? Okay, and some of you really being a part of that. And I find this framework to be very helpful, and it's also something that we are trying to use to understand and map our own work. And what I really like about it, again, you'll hopefully recognize the levels of influence, sort of the social ecological levels, right? Individual, interpersonal, community, societal. And our interest in particular health outcomes at those levels, but also the domains of influence over the life course and thinking at the biological, behavioral, the built environment, social, cultural, and healthcare. And something, again, that is driving NIMHD's kind of research portfolio and the ways that they are trying to drive work to dismantle and to understand disparities is, I think, is a great framework for school health also, and ways for all of us, I think, in our work to think about, if not our own work, but in our collective, where are there gaps in our understanding and our research, so that even if we are at the point where we are looking at sort of biological vulnerabilities or mechanisms at the individual level, but knowing that there are structural or systemic things that can help impact or drive those, even if that's not your area of work, I think is important for us to keep in mind the context of that work. Lisa's not in the room, I don't think, so I was going to apologize to her that I'm using a framework from another CHHCS, and I hope it's not sacrilegious, but I kind of like this image, because again, I'm newer to thinking in this pathway, because as you'll see in a moment, we really consider our work to be kind of at the T3, T4, and so haven't really thought much about and don't interface with folks doing work at sort of the basic science level and sort of clinical 1 and 2 type control studies. But what I like about, obviously, is way that this communicates the important sort of translation of work and translation to specific sort of domains of those outcomes. And if we were going to look at our own and kind of where we might fall, I would say that the center kind of falls in between in the work that we do, both in thinking about implementation and the drivers around effective practices, which are many of the kinds of questions that we ask and try to understand, and then its impact on populations and on public health outcomes. So a little bit about the kinds of things that we do. So we have been a long-standing technical assistance center. We have developed and created materials that we've disseminated, particularly through our website, that has been for that kind of dissemination and spread of what we know to be effective practices, tools to help communities adopt those practices and adapt them, and have been a national program office for the Robert Wood Johnson Foundation for 4 big sort of multi-site, multi-year initiatives in school health. And so that has allowed us to learn a lot. And from a lot of that work, we've also developed resources. When we've heard from communities about the types of things that make it difficult for them to understand how to take the science and the sort of evidence and actually apply it into their own work. And so we've collected and created and co-created with them a number of resources that we hope and we've been trying to measure have had influence in that area. We do again, research, and I'll go into this in a little bit, but both community-based, at local level. We don't really do work necessarily looking at sort of national level, but a lot more kind of local and even state-based work. We also consider the translation of research. And what I mean here is that, again, that there's so much evidence. For example, we know a lot of programs that work in schools, particularly around mental health, particularly around mental health treatment. We know quite a bit about those that are effective practices and programs. But again, the practitioners, the educators, the stakeholders who work in and around schools often don't have access, or if they have access to that information, don't necessarily know how to take it and translate it into such a way that it can impact their specific practices or policies. And so that is part of what we've done. We've had fact sheets, we've had to translate. I've presented at various places, again, to various audiences to try to illuminate some of what we've learned, as well as sort of talking to media outlets and trying to, again, get the message out to others in those vehicles. We've done policy analyses, particularly in this case in DC or even nationally, for example, on ways that one can fund school health programs using ESSA funding, which has been, I think, highly misunderstood, again, by many who are constantly dealing with the competition for resources in schools to know how to advance comprehensive school mental health, but also at DC levels where we have partnered with Child Trends to evaluate the Healthy Schools Act and the implementation of that act in DC. And then we've worked with communities around their own strategies. How do they advance and how do they think about what should be the priorities in their own localities, and including in DC, where we are just honored to have been asked to be a part of designing an implementation plan for what DC's comprehensive school mental health can look like, which again I'll come back to in a moment. So I say that the center is an applied research center, and what we do and what we are proud of is that we seek to answer questions in the real world and find solutions to practice-based problems. Part of that means that we have to understand where the problems are and what constitutes it as a problem, by whom and why, right? So there's a lot to explore and understand, and so we use a lot of qualitative methods for the work that we do. I put this cartoon up because it is, I think there is sometimes in some communities, some academic communities, a bias that in our work and using qualitative methods that it's less rigorous, that it's not really research, that research is quantitative. And But, you know, as many of us would know, there is such value in qualitative research that you cannot get through quantitative methods, right? Qualitative research is essential for understanding the how and the why. How does something work? Why is something happening in a particular way, right? That you can't easily get through quantitative methods, right? Whereas quantitative research often helps us understand the what and the when. Under what conditions, what happens when, right? And to test, very hypothesis-driven. Qualitative methods, much more exploratory, or can be exploratory in nature, but essential to understanding the kinds of characteristics, contexts in which behaviors, policies are being implemented, and what we can understand about where our interventions then could be effective. So this is just a little snapshot, and there's more of this on our website, of just a couple of projects, research projects that I'm going to go into, one in particular, that we've been honored to work on over the years. The Robert Wood Johnson Foundation one here, we've had numerous, but this one is where we were really looking at practices that work at local and state levels, because we were interested in this idea of sustainability. And when you have strong, effective practices and you do them collaboratively in communities, what sustains that work once that initial funding goes away? Can those stakeholders, can those thought leaders help us understand what are those conditions or those factors that are more predictive of long-term sustainability? That's work that we're hoping to publish pretty soon. We do kind of more traditional, kind of mixed methods work too, and we're working with GSHED, our Graduate School of Education and Human Development, because we're interested in better articulating what we know about the characteristics of well schools. We talk a lot about wellness, but what is the characteristic, and I'll talk in a moment about the importance of wellness for the adults who really shape the context and the climate in schools, which is a burgeoning area that we're moving into in research. But what about the schools themselves? How can we define a well school? And what are those characteristics? And there are many quantitative measures that don't capture, we would argue, that don't capture, in essence, that construct. And so we are doing some work right now and are in our phase 2 of that work, and have, as I said, using both qualitative and quantitative methods. We have worked for the number of years now with the Bainum Family Foundation, a local foundation, who has been really interested in ways that they can better support children and families in Ward 7 and 8. And particularly because they're building on a body of work looking at early childhood systems and how influential they've been in really supporting the advancement of those effective systems. But then kids go to school, right? Hopefully they go to school, in which case they were really worried, and also with the data in many places that show that, you know, gains for kids in terms of readiness for school are more likely to you'll lose those gains by 3rd grade, right, in particular communities. And we know how important educational attainment is to health outcomes, both at the immediate level, but also into adulthood, and the kinds of associations there are for that. So we've been involved in an applied research looking through a case study methodology to really try to understand what can we know about, what can we learn about how to implement best practices in schools, and what fosters the implementation of those practices and what hinders that. I share this statistic because although it is from one of the latest YRBS results, and you may not be unfamiliar with it, in mental health, as you might know, because children has been a very important partner in the health needs assessment work that has been going on across the city, where mental health has been elevated as a priority in the city for a number of years. Residents, leaders, administrators, community providers, we understand the importance of focusing on mental health. But it is particularly at an urgent level when we're talking about elements of this, particularly youth suicide as one indicator. We know that in DC, we had the prevalence of young people reporting attempting suicide in the past 12 months is double the national average, more than double the national average. That is alarming. That is something that should have us all stop in our tracks and think about what we can do collectively to curb that. We do know also that there are particular subgroups that are much more vulnerable and where the likelihood of attempting suicide is greater for them. And again, trying to think about how we adapt these practices and our work to support them in their context and in understanding them and their well-being. But also that there are conditions that we have to be very mindful of that are also impacting our kids in DC. And I'm just going to focus on kind of our work in DC right now. And how those, again, disproportionately are being represented in sort of what is being reported by young people who are seriously considering suicide. So this additional adversity, these additional stressors, which again, we don't address in traditional suicide prevention programs and work, right? But it's critical if we think about it, again, from more of an ecological perspective and are the determinants of health. This is, again, in particular, even thinking about our adolescent boys, African-American boys, where we know that the rate of suicide has doubled between '93 and 2012. And among young ethnic groups, they have the highest rates of suicide. And that now really this teenage group is more likely to die by suicide than girls, really elevating as a very prominent cause of death among Black American youth. Again, I think just underscores, as unfortunately you might have heard of some of the tragedies, even just this school year, with a number of young middle school children dying by suicide in DC. So one of the things, again, I'm going to come back now to the Bainum project as one project that underscores what we have done as an applied research center, and the school-based mental health project. Because again, although they are very interested in understanding how to support families in wards 7 and 8, where we see a higher prevalence of the kinds of conditions we talked about, and also of the prevalence of mental health needs, is what can we think about if we were also considering a multi-tiered approach to mental health, meaning that we're not only going to think about how to improve access to high-quality treatment and what role schools play there, but how we think about that from a multi-tiered perspective. Prevention and promotion activities that can hopefully curb and prevent the expression of the symptomatology, address some of the underlying risk factors and bolster the protective factors, and what it means around early identification and intervention. And so we wanted to think about that, and we thought about it through this multi-pronged approach, right? How do we think, what does it mean about what we know about practices, about research, around policy activities, and even the role of philanthropy in all of this. And then we think about who we were partnered with in the city, again, as co-collaborators, to better understand what these interventions, what we need to be, how we need to be approaching this work. And we created a strategy with them that now has become a school community of practice, and these are two of the kind of main strategies we're using, and a stakeholder learning community. I'm going to tell you a little bit about the research and the work we're doing in those two areas. Just checking on time here. Before we started, we really wanted, again, here's an application of where we did some qualitative work. And we did an environmental scan and did interviews with about 24 leaders in DC who were at this intersection and grappling with this idea of how do we implement comprehensive school mental health. One of the things that we learned, some of the common themes, are around where there was areas for growth. Now, there's definitely areas, there's strength areas, there's things that we're building on. Because of time, I didn't offer all of that. But one of the things that, again, you might miss if we were only sort of quantitatively trying to capture practices and what's happening is that we might miss the context that the recruitment and retention of high-quality teachers and staff in DC schools is an incredible barrier to moving progress and adoption and dissemination of innovation in DC. If you don't know, DC has one of the highest rates of teacher turnover in the country. In addition, we know that teachers and staff stress and burnout contribute significantly to that turnover. Even if not leaving the profession, the rate of absenteeism among teachers and staff is very high. Right? So think about the continuity, not just of education, but of relationships, of things we know to be very protective. I mean, we know what are one of the most protective factors for young people is having a reliable, caring relationship with an adult, often outside of the home, right? In addition to your relationships at home, who else can you go to reliably? And for many of us, in our career, we spent most of our time in school. And in my graduate class, when I teach, I ask everyone to think about an individual in their K-12 experience who, even if they don't think about them often, know were very influential to them in their lives, right? And that when I say three, you say that person's name, and everybody has somebody to say, right? Everyone has someone or someone's, right? The coach, the nurse, the principal, my kindergarten teacher, right? And that were very influential. But when those relationships are disrupted, when that doesn't just impact education, which is tragic, but also again the social conditions in school. So that's the kind of at an organizational level we know, one of the things we know that is going on in schools that is so challenging to even being able to implement what we were also finding were some of these critical drivers, right? MTSS stands for multi-tiered system of supports, which is what I said is sort of this public health or multi-tiered strategy for what we know to be a best practice for school mental health. And what we were finding, for example, from a lot of the interviews and from what we were seeing in the schools is that schools might say and know that they have social emotional learning curriculum. They might be able to say, oh, I have second step. We use, conscious discipline. But the implementation of that across class, one person said it brilliantly, it's like we have 43 islands, so they had 43 classrooms, and each one of them did it differently. Okay, so if you think about what that means as it relates to scaling, as it relates to, really adopting the best practice and seeing the evidence that we would expect later, it undermines all that whole process, right? We also know that within teams, people were actually really fairly good at communicating with each other within teams. There's a lot of teams in schools, right? There's the third grade team, there's the science team, there's the leadership team, there's the school improvement team, right? A lot of teams. The issue was the inter-team communication was very poor. And so that created a challenge around coordination and leveraging resources. Because what do we know about schools? We don't have the resources necessary to really address the demand that we're talking about. And so having a way to be more porous with our teaming was something that was elevated. Data-driven decision-making. Schools, if nothing else, have a ton of data. Data. What we don't have are platforms or systems that can integrate that data so that you can actually look at kids' attendance data with their social emotional learning data, with their behavioral infraction data, with their math data, right? With what we know about the social determinants of health, right? We don't have platforms to do that integration so that we can not only know at an individual child level, but at a population level at the school. We can be thinking more proactively, thinking about population interventions, right? And the capacity to interpret that data. So even in cases where there's some schools that have great platforms that get a couple of those integrated, but then they don't know how to make sense of that data in a way to drive decisions. And then engagement. Again, you have people coming in and out of school, right, constantly. But to the degree that they are actually leveraging those engagements and those partnerships, and allowing for leadership input into decisions in school. Again, this struggle of giving up power in a school in that dynamic, which often you can't really quantify, but you can describe, right? So we have, for the Bainum work, kind of a sort of an emerging kind of theory of change, which says, okay, part of what we're going to do is we're going to engage in capacity building strategies. These strategies are about giving individualized technical assistance to the schools that we were partnered with, because we engaged in a needs assessment process that was pretty extensive so that we could understand the context of schools. We did look at a lot of data. We looked at their processes, protocols, handbooks, anything that was outward-facing or inward-facing to the school to describe how the school functioned. We then did interviews with key people in the schools, and we did observations of their teaming process. Okay, so again, how we sort of used our qualitative information. And from that came a report that we gave to the schools and said, does this mirror and does this reflect who you see yourself as a school, your strengths and your areas for improvement? And then if so, once we made sure that that looked like right to them, we then created a technical assistance plan, and that's driving the work that we're doing. Then we've established a community of practice and did training and professional development. Again, what we are proposing is that will, and we are trying to measure that those activities, and we don't actually know which of these are going to be most impactful. That's actually part of the research we're doing, because there's very little research to say what kinds of technical assistance actually may be more influential or impactful to what conditions, in what conditions, right? We don't really know a lot of that in the school mental health literature. But that we would improve organizational capacity, staff capacity, and leadership capacity in a way that then will show some system improvement outcomes, as I said, in these particular areas where we saw those gaps, because ultimately leading to the child wellness and academic outcomes and family engagement that we want to see improved. So one of the things that we've had to do is to move outside of public health and psychology theory, because we needed to go into like the organizational change literature to better understand and inform us. And I always tell my students, don't be scared of theory. It's our friend, right? It's something to kind of guide us. And so, we were really happy to have come across an organizational change sort of framework from Timmings and even Holt, who basically said that in order to really have organizations change, we have to pay attention to 4 particular domains. One is who the individuals are and their mindset, their beliefs, their attitudes about that change. And in our case, it's about how do they feel about comprehensive school mental health in schools, and the practices we were trying to get them to adopt, okay? What's the beliefs, what are the attitudes? Also, this individual structural domain, which is, do you have the knowledge and skills and training? What you hear often in schools, I'm an educator. I don't do mental health. I haven't been trained in mental health. I don't know what to do when I have a student who is in crisis, right? So at what level do we, what training and coaching and do they have? Again, very reflective of implementation science work, right? When you think about staff selection and the importance of the qualities of staff who are implementing the kinds of interventions and innovations that we want. But also the organizational psychological domain. And here it's about what are the values of the school? What are the norms of the school? What's the climate and the culture of the school? We can measure that, right? And so that the context in which all of those things are supposed to flourish, and the organizational structural domain, which is what are the actual tangible and intangible resources, including materials, time, funding, that is available in order to see that change. So these are, I've like made the biggest bow tie. I'm supposed to put this many words on the slide, but I wanted you to see the kind of how and why kinds of questions that are formulated as part of our research questions, right? And that we still are looking at outcomes that I think are very traditionally important to both our education and our health partners, right? We want to understand how to decrease out-of-school suspension and reduce office referrals and increase grades and decrease absenteeism, right? These are still the things we hope to see, but we're asking things around implementation. How does the school organizational and leadership characteristics influence readiness to change, okay? What gaps in school capacity exist, and what kind of technical assistance that we provide could improve that school capacity? These are the more of the how kinds of questions that our work leads us to think about. In doing so, in addition to the individualized TA, part of how and their needs assessment work that then gave us a sense of their unique infrastructure, we also wanted to make sure that we were clear on what were the best practices and one of the things that we are missing, again, now I'm putting the hat on as a sort of translation of science in that specific way, that there are best practices, and this is the area of family engagement. So I told you we had those big 4 domains, right? MTSS, data-driven, family engagement, community collaboration, right? And for family engagement, that there is no one place schools can go to understand this is the best practice, so how do I assess myself against that standard or that practice, and then know what I'm supposed to do after that, right? So what we decided to do is we culled and found, did a significant research into what we know to be validated, corroborated best practices in family engagement, and these are some of those sources, and we did that for each of those domains, and then created what now is a best practices indicator tool, which, again, we will be using as a quality improvement tool for the schools, but also to give us a sense of kind of baseline where our schools are. Right now, we are still piloting it. We are doing the psychometrics of the tool, so we're kind of in the middle of that. So again, putting more of our quantitative hat on, but loving that this has really emerged from our qualitative, exploratory work. And in these 4 domains, looking at how do we phrase, how do we describe kind of what a gold standard for that activity is, and so where room for improvement can be articulated. So then, as we talked about, there's this work that's focused on the schools, right? How to really move their practice and adoption of best practices in school mental health. Then we also have this group, the stakeholder learning community I told you about. This is a group that we knew are very invested stakeholders in school mental health, and it represents a diverse group of 15 people across the city who have been doing this work at various levels, as parent advocates, as school administrators, as community leaders, who have come together to do system design work, and particularly group model building. And the goal, if you haven't done group model building before, this was new to me, so about a year and a half ago, I wouldn't have known what to say about this. And so I've been learning as I go along. But that's, again, one of the, I think, the wonderful features. Also, reminding ourselves that as researchers, we are part of the research, and that our knowledge and experiences grow, and that influences the work. Is that group model building improves mental models for making decisions and actions. And it's through bringing together diverse stakeholders and understanding their unique perspective on a complex social issue and being able to create a mental model of that, that you can actually move forward with system change and system improvement, okay? So again, leaning very much into understanding perspectives and kind of the common language that's being used. From these models, you can then move, I think, more easily into hypothesis-driven kinds of research that allows you then to test certain pathways or assumptions that we're making, right? So this is what, in the end, we are so proud, has now, in the last week, done this group model building work with 32 parents in Ward 7 and 8, actually across the city, but we did it in Ward 8, and with 38 high schoolers in DC. It was fantastic, so fun. They totally got into this. And there's a receptivity to talking about mental health, that yes, stigma continues to exist. We have to think about that. We have to address it. But DC is at a very different place than many others around our willingness to advocate and just share about the need for mental health. And youth and parents are the most powerful advocates around that. And this just kind of describes a little bit of the process. It's a pretty structured process of describing and kind of understanding what people's perceptions are around what is quality school mental health and what are the barriers and facilitators to high-quality emotional supports being given in school, right? So from a perspective of a kid who goes to Friendship Edison High School, I'm going to tell you what I think. As a parent of a kid in Anacostia, I'm going to tell you what I think. And that work leads to them working together on these sort of causal loop diagrams. This is what I propose to be how this influences this and why. That then gives us something that's integrated and synthesized, and this is one of our latest models. Just want to impress you, nothing that you're going to do with this model, right? But meaning that it's a very rich model that now one can also say, what would we do to test parts of this model? Can we test it in some way? Is that what a next step should be? What's driving the high levels of unmet need? What could drive that down, right? And so again, the perspective only gets enriched. We have not yet incorporated the youth and parent voice into this. This was just the diagram from the thought leaders doing it. We're going to now incorporate in the next 2 weeks, young people and parents, and then we're going to take it a little bit on the road, because now we want to know, and I'll show you this next. So I'll come back to who we're going to share this with. Third example is, and I'm almost done, so we can sort of open it up for questions. We have been honored to have a contract from the DC Department of Behavioral Health to support them in the implementation and expansion of school behavioral health across the city in all 244 public schools. We are the technical assistance provider, right? And as part of that, we have decided the approach we're going to use is to establish a community practice, but in its truest sense, because we use community practice very flippantly many times in the way we talk. We're talking about the way N.T.M. Wenger talked about communities of practice and what that actually means. These are groups of people who share expertise and a passion about a topic, interact on an ongoing basis to further their learning, to problem solve, discuss insights, share information, develop tools and frameworks. Over time, these mutual interactions and relationships build a shared body of knowledge and a sense of identity. We've created a community practice around school behavioral health for a couple of reasons. One is because it's important, this idea we're learners and leaders. So it's not a hierarchical process. It's not me saying, hey, I'm an expert in school mental health, which sometimes people approach me as that, right? Well, you're the expert. Can't you get up and tell us and do some training, right? I say, yes, I could, but that's not, I don't think, what we need. Why? Because knowledge is out there. People know much of this. Something is standing in the way around the effective implementation, around the adoption of those in practice. There's problems of practice that we have to better understand, right? And we would argue, again, that those practitioners are the best ones to tell us what those are, and then we can design some of our interventions around that, again, thinking in sort of a multi-tiered approach. This is just a little bit of a schematic of how we're structuring the community practice. So we have, so far, we're engaged half of those schools, 119 schools in our community practice, and we have a core team and trainings and technical assistance and what we call practice groups, which are much more content-driven ways that if you're really interested in trauma-informed practices or crisis intervention response in schools or positive school climate, these are the topics that the community, so that group of invested individuals, said were the critical points they wanted to start with. These are the things that are driving us crazy because we believe in trauma-informed practices, but I'm having a hard time getting my principal to take that on. Or we know what our protocol is for crisis response, but it sits on a shelf, and when there's a crisis, everybody splinters and goes in different directions, right? So what about that is missing, right? And so this is what these practice groups are going to be doing, is really thinking and going deeper in those problems of practice and coming up with dialogue, understanding, tools, tips, things that we then will test and work on in our communities, back in our schools, and come back and actually learn something about and try to iterate on that. But this coordinating council that's sort of overseeing things is, again, an important body, because I'm thinking about my interest in investment is in system improvement. I care that every individual school is working at maximum capacity to support kids, but I want that to be institutionalized at a system level, right? This coordinating council is a new body. This is the body that is diverse. It's about 25 individuals that are appointed by the mayor to oversee the implementation of this expansion for school mental health. What's important about that is that that group really has a lot of influence. That's one of the groups that we're going to bring that group model building design work to, and saying, this is what residents, thought leaders, and others among you believe are some of the issues that are impacting, making it harder for us to implement best practices. What now in your role, how do you feel about this? Does this resonate? What do you agree with? What don't you agree with? And because they have a different perspective, right? They're thinking about funding at a city level. They're thinking about politics. They're thinking about things at a different level that, again, sometimes we at a ground level aren't necessarily thinking about. But what could then we do to collectively address some of those issues? Part of the work by N.T. Wenger and Trainer include the ways that we then measure whether we're having impact. And they would measure it what they would call the value creation cycles, which essentially is to say, are we collecting evidence? Are we collecting stories that are telling us something about the value of those who participate in these social learning environments? Okay, in a social learning environment, we're both leaders and learners, right? And as such, do we know and can we articulate the immediate value somebody has? So from this is more of a talk. This isn't necessarily what I would consider a social learning until we open it up and have some more dialogue, right? But what would be the immediate value? You know, did you learn something new? Did you connect with somebody? Do you have a new insight? Did you get to vent something so you feel better? What is that immediate value? What's the potential value of having engaged? So essentially, do you know something that even if you don't put it into practice, makes you better because you know it? So now you know something about how to do something better, but that situation doesn't come up. It's okay, you still have the value of the knowledge. You know a new network, you have access to something. You may not necessarily apply it yet, but there's something valuable about knowing that network or those resources exist, right? Then there's the applied value, and this is where we're really trying to get to. Because what matters to us, yes, we want you to have the knowledge. Yes, we want you to know where to go for things, but we want you to apply it. So what do we know about how there is some applied value and where it's changed your practice and this realized value, your personal performance, your school's performance, something about how the system performs, and then ultimately this reframing value, which is, are we ultimately doing business differently in DC? And that's what we hope to get to in 5 years. I want to share with you that part of also what the value of being at a university and as applied research is that we get to do a lot of student-conducted research, and actually some folks who were sharing, students that were sharing between children and here in a number of studies that I think are pushing the work forward and that, again, are utilizing some of those methods that we talked about. Finally, I'll just, again, give a nod to, again, our primary aim in a lot of this work is understanding how we advance the adoption of effective practices and thinking certainly grounded a lot in implementation science and understanding what we need to know around context, around confidence, around, I always talk about sort of what are the necessary preconditions. I'm not going to go to a school to say, part of the expansion is you partner with a community mental health agency to supplement the work you're already able to do in school, right? That marriage and part of the magic of that relationship requires that there's some necessary preconditions on this end and this end, right? Otherwise, there's going to be a mismatch, or it's not going to be a happy marriage, right? And so what do we know about what those conditions are, what those skill sets, what that knowledge needs to be, and the readiness? Are we measuring the readiness to adopt? Because not every school is ready to take things on at the same time, and that needs to be okay. That needs to be not valuated. Not every school is ready for that. So how do we sort of scaffold and do that in such a way? Things around communication, a lot of our work really is QA, QI. It's really in that domain, because what we're trying to do is understand how information will feed back to an improvement in practice, right? Our research really is in service of that. And what do we know about the best dissemination methods? What do we know about social learning spaces, networks, and coalitions as a potential driver, facilitator of the dissemination of what's working, right? And the outcomes and effectiveness, because ultimately, again, for us, the gold standard really is around sustainability and how can we see something really embedded in our work long term. So that, my friends, is it. And I hope that you maybe have seen some ways that in your work we might be able to kind of cross paths or sort of support each other's work, ways that you can help me, better elevate what we're doing at the center. So again, I just thank you so much for your attention and for your interest. We have a few minutes for questions if anybody has any.
So I just had a question about sustainability. Some of your early slides talked about the turnover is
Yeah.
teacher staff.
Yeah.
I suspect that would be true of American cities also. So how, and another part of your model has to do with building things over time,
Yeah.
so
Yeah.
how does that work?
That's a great question. So, one of the things that we're doing, I don't know how it works yet, but that's the short answer. Okay, but the longer answer is, we are asking ourselves as we are thinking about interventions, so what, if you were doing capacity, technical assistance, capacity building, we need to assume that who we're working with will not be there next year. So how do we change what we're doing in light of that, right? What are the ways that we need to do something different, knowing that there's better than a 50% chance this person, as a matter of fact, we're working with 4 schools in Ward 7 and 8 for the Bainum project, but now we're working with 120 less light touch, or not deep technical assistance. For the 4 schools that we're in, we thought for sure 50% of them, there would be some movement. 100% turnover in principals and in the people who are points of contact in the school, 100%. So the community of practice work that we were doing, which includes the 4 schools coming together, because part of what they said is we're charter schools, we have no space where we can grapple with each other, share resources, share knowledge. We said, we're gonna establish a monthly community of practice. We'll feed you, you come, we will facilitate the space. They love it. Every single person is new this year, which meant that what we thought we would build on, which was to let them then become more of the leaders in that work over year 2, we had to start back and say, all right, well, rewind, we do more of that foundational work with the new folks, making sure they understand and feel comfortable, and then hope, but so now we said, so how should we do this differently? Because we could maybe have 100% turnover again next year, right? And yes, the student movement among schools is very big too. And so I am always thinking about then what are the structures? What are the ways then that we can think upstream? For example, what are the ways that some of this can be embedded in certification and licensure requirements? What are some of the ways that in pre-professional training we should be doing more? What are the ways that as we're selecting principals, and schools are selecting principals, that we should be coaching them on the kinds of questions you should ask for who they're selecting as their leader, right? What are the ways that we can put this in an outward-facing policy or your handbook so that you are going to be held accountable because it's now in writing, right? What are the ways this is embedded in your teaming process, right? And so we're trying to think about that, again, with our partners to say, what are the best places for us to institutionalize this? Because it is our reality. I think in time we hope to curb that and even maybe reverse it, but it's the reality. So, good question. Any other questions? Some of you would love to hear other thoughts or even comments. Yes.
I want to thank you so much for the perspective that you're offering us in the organization of these thoughts. And I do want to share with you that we work closely with school nurses, particularly across the wards and 7 and 8.
Yes.
And there is low turnover there. So they might become a group for you that has a little more stability, and they rotate to that. Yeah.
That's awesome. We just had a conversation 2 weeks ago. We were talking to Department of Health about their permission to be able to engage. You all here, we understand we understand the system, the hierarchy, and want to be mindful of that. And but absolutely are in agreement. One of the things we've learned, right, through this is that where is more of that stability, and where could we? So same thing in schools. Where is some of that stability? Some of the, for example, front office staff or community coordinator, family community coordinator, folks that are really invested in those neighborhood schools that are really going to stay on and that have a track. What could we be doing to engage them more in their positions of influence? And so, absolutely want to continue to talk about that.
Yes. So, I'm sorry, I missed the front part. As I'm listening to this, first of all, I think this is a model for any disparate groups of people, different groups of people coming together to try to affect and change. Your last slide, I think, could be applied to the CHHCS, for example. The question that I have is beyond outcomes, and metrics, how do you sustain this? I really was disheartened by your last comment that there's 100% turnover. So how do you institutionalize this? You know, how do you ingrain it in the sort of the mindset so that the advances that you make are not just contingent on the participants who got you to the point that you even are being able to make changes in a sense of.
We too were disheartened. But you know, some of us had said, you know, but I'm an optimist, so we got up again and we said, okay, we got to learn from that, right? That was evidence for us, so let's take that and move. Is that we had to ask ourselves, not just at the building level, so part of the answer is, you know, within the buildings, where are we seeing those who have an investment long-term in those schools and are staying, and where can we deepen those relationships, and those structures in those schools. But we also had to move out, right? We had to move up. And part of the answer is the ways we need to engage particular coalitions and networks to take on this charge and to take on this work, right? That they have an understanding of their role. So, for example, the coordinating council. They are incredible advocates, also to what these best practices are. Some of them are practitioners themselves in schools. They're folks from here that are on that, you know, from children, you know, Beers and Libby and others who really represent this work well and this intersection, and who have been around. They're not folks who are leaving those posts anytime soon, we think. And so part of then the challenge is, for example, workforce development is a big issue. One of the things that came out in our model, right? Well, it's all fine and great, except that, and it's wonderful that this mayor has invested in this collaboration, and now we have 11 community-based organizations who said they want to partner with schools, so that's fantastic, because that's a new model, right? Going to community-based mental health organizations, that's new, and building their capacity to do this school-based work, right? And yet, they are competing for the same social workers and counselors, because there's not enough of them in DC. Right, like, oh, right, we don't have enough folks who can actually be hired to go into the 119 schools, ultimately 244, and so that we can realize, right, the benefit of what we're talking about. So then we've had to establish the coordinating council, a way to think about workforce development and pipeline issues, and how can we think about this strategically, because that is a real problem with practice, right? A problem to this working is understanding how to do that. So it means that, like, teaching places like Children's and, you know, in Georgetown and GW, like, what do we need to think about as it relates to, you know, partnerships with Catholic and other places, and how do we come together to think about this one element, right, this workforce issue? And there's a body now, a small body that's looking at that and consider. So I think it's finding a home for some of these issues as they unearth that then have some sustained attention to them, that we can then map a strategy around and try to pilot and test that strategy, that I just gotta believe some of that will take, and that we'll see some outcomes.
Thank you so much.
It was a pleasure to be with you.